what is optimal and what is normal and what it falls in a lab range could be many different things. So sometimes it depends on what we're looking at. So the first thing would be, let's just talk about thyroid. Testing for thyroid has not always been around for a long time. In fact, we've talked about this before in our podcast that they used to give clients Armour thyroid and then check with the patient to see how they were feeling and what they were doing because they didn't have lab values. Now we have all these lab values and we're still kind of lost as to what that means. So my definition of optimal means that a patient is getting an outcome that is healthy for them. So numbers are good. They're tools, they're places that we can go to see how somebody's going along, but we still need to have your symptoms and whether they're improving, getting better or worse. So we have to treat the human and get the conversation going as to whether or not what is happening is really good or not. And that should be true with any medication.
For sure. And labs are just a tool to go along with symptoms and history. And Jan and I have been doing this long enough. When we interview a patient, it's almost like, well, we don't really need to check your hormones, but we do just to see a baseline. But you know what's going on. If they're having hot flashes, they have low estrogen, probably, depending on where they're at in menopause versus perimenopause. If they're having any kind of cycling issues, it's probably low progesterone. So you can already tell that. So you just kind of get a lab to verify it. But then again, let's say that woman is still cycling. Let's say she's perimenopause, but her cycles are all over the board. She cycles 1 month, doesn't cycle another month. You might check her progesterone and you just happen to catch her during a time when she cycled and her progesterone will look normal.
Right.
Well, but that doesn't mean it's normal throughout the entire cycle or month to month. There are many women who, even per definition, the definition of postmenopause is you have ceased to cycle for 12 months. That's the strict definition of postmenopause. But yet there are many women that they don't cycle for 10, 11, 12 months, and then all of a sudden they cycle. So there again, we have to treat patients, not lab levels. That's what's really, really important.
Right. And the other thing to keep in mind too is that labs are not always accurate because some things depend on time. Like, for example, if I had somebody's thyroid checked at the end of the day, I may not really care so much what their free T3 level looks like because I know it's going to be in the tank. It's going to be low because it should be low. So, there's some nuances that need to be paid attention to as to whether or not that lab value is important or good. So again, we have to look at what's happening with the client, when the lab was taken, how it was taken. So we get this all the time with testosterone in males. Well, I had this level drawn and it's here, but they had it drawn how many hours after the fact or at the end of the day. So of course, their levels are low.
Yeah. So when did they take their last dose, whether it be thyroid or whether it be testosterone? So on that same subject, that's why you need to go to a specialist in hormones because they not only order the right labs,
right,
but they also know how to interpret it. So if the lab looks like it's high, let's say you're on testosterone, the lab looks like it's high, but you just took your testosterone, then they're not going to automatically say, oh, your testosterone's too high. We need to decrease your dose. Or conversely, if your T3 looks really low, but you haven't taken it for 24 hours and you're on thyroid, T3 thyroid, then they know that you're just basically back down to baseline and they're not going to probably change your dose. You probably just need to take the medication and see what the lab is within a couple hours after that. So labs are a tool to go along with symptoms and history. That's why it's important to go to a hormone specialist. And many times, if you don't order the right labs, they're going to look normal.
Right.
So it's important to go to a specialist that knows how to interpret the labs and which labs to order. So